We want to say welcome, welcome, welcome to Empowerment Liberation Cathedral. This is our Word Wednesday. Welcome, welcome, welcome. We do want to give you a few moments to join in with us. Once again, welcome to Empowerment Liberation Cathedral, better known as ELC. We have a great panel discussion for you on tonight. And so we ask that you would make sure that you hit like, make sure you hit share, and make sure that you create a watch party so that those people who are connected to you can have the wonderful opportunity to hear this panel on tonight. We are expecting a great talk on tonight, and we want to make sure that not only you, but your friends are able to experience this conversation as well. I believe this is a very needed conversation. And so, therefore, we are having it here at Empowerment Liberation Cathedral. You know, we're not afraid to talk about those things that matter. We're not afraid to talk about what's going on in our society and community. And so, tonight, I ask that you would join us as we prepare for our panel discussion. Once again, we want to give you a few moments to hit like. We want to give you a few moments to hit share. We want to give people a few moments to get on and join us here at Empowerment Liberation Cathedral. Once again, you can join us every Tuesday at 9 p.m. for prayer. We have live prayer. We've encouraged people, if you want to be on our prayer list, to email us at empowercathedral@gmail.com so that you can get on the prayer list. Also, if you want, you can text or inbox one of the deacons or the ministers, and they will add you to the prayer list. We want you to make sure that you join us on Wednesday, every Wednesday here at 7 p.m. for our Word Wednesday. And on Sundays, we want you to join us every Sunday at 11 a.m. right here on Facebook Live for our Sunday worship experience. And believe it or not, we have cut that to an hour. That is a miracle for a good Baptist as myself. Okay. So we have cut that to an hour. And so we want you to join us. So now we're glad to have Deacon Sylvester Stokes, who is on our panel tonight, and Deacon Kim Hall, who is on our panel on tonight. And tonight we want to talk with you about some of the racial disparities for people of color during COVID-19. And so I want to give some information, and then we will be ready for our discussion. We understand that COVID-19, the numbers are very high of people who have contracted COVID-19, as well as those who have died. The number, I believe, is somewhere near, correct me if I'm wrong, I think I moved that page, 131 deaths, more than 131 deaths here in the United States of America from COVID-19. And so we want to understand, while there are 131,000 deaths, some are more apt to be a part of that number than others. And that's what we want to talk about on tonight. And so longstanding systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. The racial and ethnic minority groups include people of color with a wide variety of backgrounds, but we know people of color are African Americans, are Hispanics or Latinx. We have the Pacific American Indians. We have the Asian persons. There, am I forgetting anybody in that group for the people of color? Okay, and so those people are the ones that are at higher risk of contracting the COVID-19 as well as dying from it. And so increasing evidence demonstrates that some racial and ethnic minority groups are being disproportionately affected by COVID-19. And so if you are a person of color, you may be a person of more than one color, whatever the case may be, there are social determinants of health, such as poverty, healthcare access, education. And we're going to talk about some of the things that are causing people of color to be more likely to contract COVID-19 than non persons of color. So, the first one I want to talk about, I'm going to ask the panel about, is discrimination. Discrimination, we know, has been around forever. African Americans have experienced discrimination in almost every area of life or every walk of life. So when we look at discrimination, discrimination is also impacting our healthcare system. And so when we look at those persons who need healthcare, who need to be treated, and policies and things that are put in place often are not in favor of those who are persons of color. And so discrimination does include racism. It leads to chronic and toxic stress and shapes social and economic factors that put, once again, people from racial and ethnic minority groups at increased risk for COVID-19. And so, how have you seen discrimination impact those who may have been trying to access health care when it comes to COVID-19? Anybody?
So for me, having being the person providing the weekly updates in terms of COVID-19 numbers for the United States, for the world, as well as locally, uh, the numbers have always represented a disproportionate number of high cases when it comes to people of color. And so when you ask the question in terms of how is that discrimination played out, you look at the number of facilities, if you will, in the neighborhood of those people of color as less than those of people non-colored. And so that's one situation. We look at the impact of what COVID did in terms of shutting down institutions and access. You talk about transportation. Look at our local transportation in terms of public transportation. A lot of the bus systems were basically cut off or very limited. And so if you're sick and you have to travel a distance to get to an access point for healthcare, 9 times out of 10, you're not going to do it. For those people in terms of family, when you look at job situations, some people were laid off, some people were forced to do at home work, telework. Your kids are there. So then you bring in childcare. And so you're sick as a parent, you don't have access to a facility. And not only that, you have to stay at home and work in order to make money. And so it appears that it's always a snowball effect, if you will, that if one thing happens, then something else is going to happen. So unfortunately, with people of color, it kind of seems like that's that same framework all the time, regardless of whether COVID or something else.
I remember when they were announcing some of the locations for the testing sites and centers for the COVID-19. I continue to think, why are those sites in those locations? And how are people going to access those locations? And I could not understand how, African Americans, especially, and Latinx persons were going to get to these locations. Even with people with a car, they seem a bit far. And so, was it that they were intending for everybody to be tested, or was it that they were intending for the whites to be tested? And so that was what came to my mind when they started talking about some of the testing centers. um, you know, Naturally, the states came in and helped to make these free testing sites for people. But when you talk about free, but you can't get there, then it don't make a difference if it's free or not. And so, That was a thought that I had. And so, how can we, did you want to say anything else, Deacon, on that?
No, I was just going to say you're absolutely right in terms of the placement of the testing centers. What I observed is that most of those centers were placed in areas where the local governments had the funding and they were willing to actually support it. Where if you're in a neighborhood where funding is not as much, very limited, unfortunately, the thought was not to place a COVID testing center there.
That's exactly
Okay.
what was the
Okay.
first. That was the first thing that came through my mind was when COVID first hit. The places where you could get tested were not in our area. They were you had to drive for it, and I don't even know if it was free or not. But I know one of the things I noticed in the beginning was that a lot of people of color um, were sent home from the hospital because they said, no, you don't have it. No, you don't have it. Then turns out they did, and then they died. A lot of people, you saw people on the news. I remember two cases in particular where the dad in Virginia who died because he went to the hospital like 3 times and they told him you don't have, I think he was Hispanic, and they insisted that he did not have it, but he did. And then he later died. And then there was another lady, I think she was from Prince George's County. She was on television gasping for air. And then they kept telling her, no, you don't have it. No, you don't have it. And she couldn't find a place to get tested. And I'm like, well, how are you going to turn her away? She has all the symptoms, So that's what I remember, especially in the beginning. There was no testing in our neighborhoods.
Right, you're absolutely right. And that was very disturbing because, people of color went 2 and 3 different times to try to prevent something from happening, and something did happen. So then where does that leave the community with the trust issue? Because first of all, we still have in the backdrop this historical trauma that we have experienced from working with these systems and these institutions. And so now people are working to try to trust the system, try to trust the institution. And now you're proving that you're not trustworthy because once again, a person did come and all you did was told them to go home. You didn't test them. And that happened to record numbers of people. And so a lot of those people did transition because they did not get the help that they needed. And so once again, like we said, they placed them in places that had money. And yes, some of the smaller urban areas may not have had the money to pay for those sites. But at some point, you got to realize we have to help everybody. This is for everybody. And if we're seeing high numbers of African Americans and we realize that they may not have transportation to get out to these places, then at some point somebody has to say, we're going to put numbers of facilities in the inner community, in the inner city, so that people will have access. And so discrimination, once again, is still a part of what we see happening with our healthcare system on today. So when we talk about healthcare access, a lot of times you have people who in the racial, ethnic, and minority groups that are underinsured or not insured. And so you have, once again, the insurance issue or the coverage issue when it comes to people of color. And we talked about this. Healthcare access can also be limited for people of color, such as lack of transportation, the child care, ability to take time off work, communication and language barriers, cultural differences between patients and providers, and historical and current discrimination in healthcare systems. Now, we talk about the language barrier. That's an issue oftentimes. And so you can't just have one person who speaks other languages on staff, because if that person is ever out, that person takes a break, if that person, has a meeting, then what are you supposed to do? And so the language barrier has to be something that we have to deal with in the healthcare access, for healthcare access. But one of the things that struck me in this one is that oftentimes our people, or people in the African American community and minority community, don't have the availability to take time off. You know, some of the drive-throughs, when I saw them, people in line, they're in line for a long time to get that test. So let's just say if a person says, okay, I'm gonna take an hour before I go to work to be tested, but the line is an hour and a half. And so now what do you do? Because you can't afford to be off work. And a lot of times people go to work sick that are minorities because they can't afford to be off work. Because a lot of times the minorities are the ones who have these jobs where you have to be at work in order to get paid. Anybody want to comment on the things that we have seen as far as lack of transportation, lack of childcare, lack of ability to take time off of work, the communication language barriers, cultural differences?
I would just like to comment on the language barrier. I do know someone that's currently working at a COVID testing site. And so it would be interesting to know, do we have interpreters there? Not just for the actual language, but what about those people that are hearing impaired and need to be tested? How do you communicate with them the right thing? Because most of the workers, if you will, at the site, they're not licensed. And so they're giving instructions on to how to complete the test, how to complete the swab. And so if you're not able to correctly communicate that process to them, how do you know that they're doing it correctly? So you could actually have a false positive or a false negative.
Yes, right, right.
Yeah, the transportation issue is also huge because you think about it, a lot of the COVID testing is drive up. So, I mean, the Metro bus is not going to sit and wait for you to take a COVID test, right? So that was disappointing. Later on, I think they did find places where you could, I think it was at FedEx Field or something like that, where, you know, it was big, large parking lot. But that is a huge barrier to testing because everywhere you see testing, it's drive up. So now if I think I have COVID, I have to get somebody who doesn't have it to take me to get tested, you know? So, and then the other only way was to go to the emergency room. And, you know, I think you have to prove like you have COVID. You don't just get tested there, you know? So.
Actually, that's changing. And
Oh,
so
okay.
in the beginning and in the middle,
Yeah.
the process is that basically if you're asymptomatic, they basically didn't test you because they didn't believe that you were positive, that you were exposed. It's a little different now, or it's changing currently as we speak, in terms that most of the patients that enter the emergency department, they are tested.
Okay.
And in some hospitals, some of the associates are being tested as well on a regular basis. It's just starting to happen. And so that's a huge difference. But yes, in the beginning, if you didn't have symptoms, you're not going to be tested. They didn't even want you to come to the emergency department.
Yeah, that's what I remember there. I remember that part right there.
Absolutely.
Yeah.
Well, let me say, I have a family member now who has been exposed to COVID. And that particular person does not have a car. And so she is having a difficult time trying to get a test in the state where she lives. And it's been interesting because I could not believe that, you know, all of the places around her were drive through. And she says that all of those places are drive through and that she is unable to walk up somewhere and get a test done. And so I just, to me, that is discrimination in all kinds of ways because, first of all, they are still living in what is considered to be a predominantly Black area. And so with that, how is it that everybody is expected to drive a car through the drive-through in order to get tested? And so I think that that is limiting persons who may want to do the right thing and know if they have it so that they can self-isolate, to where, you cause them, or, they may just go back out into the community because they're not sure and they don't have any symptoms. They don't feel like they have it. And so, I think that raises some real questions. I do know about the CVS and the Walgreens now. They're testing, but from what I heard from her, some of those sites even are drive-through. Anybody know
And I
about
believe
those?
most of those sites are. I actually, I don't remember. I can't recall a specific site where you could actually walk in or walk up to a station and get tested. And to be honest with you, and it's shame on me, but I never really given it much thought, that it's actually excluding a huge amount of folks
Yes.
in terms of discrimination.
Now that we're talking about it, it like occurs to me every time I see a COVID testing, it's always drive up, but even McDonald's lets you walk through the drive through. I mean, come on, they should have a little line somewhere where,
But
if you don't
bank
have a car,
at the
exactly.
ATM, you can walk
Yeah.
through the ATM at the bank area. You just got to wait for the cars to go by, But yes, they will not allow you to do that. And so once again, it's already far out. And then now you don't have transportation to get to a place, and you can't walk into a place. So I think that is putting a lot of stress and pressure on those persons of color that may use the rail system, that may use the buses, that may use the subway, that may use even Uber,
Right. I
Lyft,
was gonna say that.
and those ride sharing types of things to get to where they have to go. Okay. So
You know,
also when we look, go ahead.
now I was wondering, when they had set up the big COVID testing area at FedEx Field, and now it's like, don't we need that still? Why did they break? It seemed like they spent more time setting it up than they actually tested. And they didn't test every day. They only tested on certain days. And then it was here and then it was gone. But now, like, we could use that right now. I was just wondering why it seemed like it came and it left just
Right.
like that.
Right. Well, Deacon Kim, I can't tell you why it left. I can tell you with the numbers, I can guarantee you they're coming back and more, throughout the world, throughout the nation, and even locally. The numbers are just sky high. Bishop talked about what the numbers are, and I'm just going to quickly, as I normally do. When you look at the world numbers, you're talking about 56.5 million positive cases, with over 586,000 new cases in 24 hours. That's huge, with 1.3 million deaths. When you talk about the United States, 11.8 million confirmed cases, with 155,000 new cases in 24 hours. In the DMV area, you're talking about over 7,000 new cases in 24 hours. That's huge. And so whatever stopped, a couple of months. And so when you look back at the cycle, you had December, January, kind of low numbers. And all of a sudden you had this huge spike. And so February, March, and April, you had all of them given to COVID pandemic. Then around May, June, the numbers started to slip. And although there were more exposures, folks were not being hospitalized. And so it's back to the original thing. Their numbers are increasing and hospitals are packed throughout the nation, throughout the world. If you listen to the reports, you have people driving up to the emergency department. You have ambulance up at the emergency department around the corner, parking, waiting to get in. Not locally, but throughout the nation. And so I can tell you personally, where I work, we're back at capacity. And so I believe that although the governments are somewhat converting back to some restrictions, I believe within the next week or two, we're going to hear more about closing down some sites in terms of businesses. You're going to see some restrictions in terms of where you can go and where you can't go, maybe even curfews during certain times. And we already know that before it was like when you're in front of someone, you should have your mask on. Now it's whenever you leave your home. If you're out in public, period, whether someone's standing next to you or not, you need to have a mask on.
Yes. And thank you for sharing that, because that is important, and it brings me to my next topic. We want to look at the occupation of minorities. When we look at people from some racial and ethnic minority groups, we can understand that they are disproportionately represented in essential work settings such as healthcare facilities, farms, factories, grocery stores, and public transportation. Some people who work in these settings have more chances to be exposed to the virus that caused COVID-19 due to several factors, such as close contact with other workers, not being able to work from home, not having paid sick days. So when we look at it, we have to understand that the minority communities have, once again, high likelihood of contracting the virus by simply living in the urban areas that they live in, and disproportionately working in higher risk environments. We remember in the beginning of this, they talked about people who worked in grocery stores and people who worked in different places. You were at higher risk of getting COVID-19. And once again, we talked about African Americans, a lot of them, and people of color, do not have the types of jobs where you can just work online or work from home. And so therefore they're continuously going into these spaces where they are at higher risk of contracting the COVID. So anybody want to talk about some of the occupational challenges that we have as people of color? Because a lot of our folks can't take off work. They need that work, because if they take off, it's a day without pay. And so we've heard from a lot of people who said, I cannot afford to be off. Even if I have something that feels like a symptom, I still got to go to work. So, let's talk about that, because that's a real issue in people with people of color or in our community.
Well, I know for me, my job deals with teaching people how to do something physically. So, when we were working from home, we weren't getting much done, as far as training wise. And now I'm back at work, and I wear 2 masks at work because I can't train from home. So, I know for me, someone at one of the locations I work at was tested positive, and I was very thankful that I hadn't been in the building for a couple of days. But it's just like most of us, like me, I can't get my work done at home, and some people have chosen to take FMLA, but they're not getting paid for it. But for me, that's not an option. So I just, like I said, I wear 2 masks at work when I'm at work, and I carry the wipes that they gave me. I carry every time somebody has to touch something else. Here's a wipe. Here's a wipe. Here's a wipe, because I can't afford not to get paid.
Yes, thank you for sharing that.
Yeah, just to piggyback off of what Deacon Kim is saying, those individuals that don't have the opportunity to work from home, like our trash collectors, or our, down in DC, our Metro bus drivers, and even the people that still are driving Uber and Lyft. It's unnerving that we are in these positions and they're still sitting on another stimulus. We don't have the FMLA. It just protects our job, our position. It doesn't, it's not short-term disability, and even short-term disability, we only get 60% 55% of that, you know. And so I'm just puzzled why they're not releasing a new stimulus for these individuals that are still essential, bus drivers,
Mhm.
to pick up our trash, the individuals, the ambulance drivers. I mean, all of these essential individuals that don't have the luxury that, and I'm saying this very lightly, that me and my wife has, because we work from home. We're both in healthcare, but we work from home, and we don't have to go outside to go to these jobs. So it's mind-boggling that this stimulus bill, that they're just sitting on it again, because they, of course, they trying to, well, that's a whole different subject, whole different topic, so I'm not even gonna go there. But something has to give. Something has to give. Somebody has to say, hey, these people need, they have kids to feed. These children are hungry. You know, they're going to bed. Maybe they're not being able to have their heat paid because maybe somebody has gotten COVID because they're these essential workers. And, you know, something has to be done. You know, we can do as much as we possibly can by helping out as much as we possibly can, but it still has to start from the top in the government to say,
Mhm.
okay, we got to get these stimulus packs out again.
So, absolutely right. Absolutely right. It's the government's responsibility to make sure that we as a nation that we're okay. The flip side to that, you were talking about the essential workers, but what about the non-essential workers who, during the initial shutdown, if you will, were not allowed to go to work, but because of the economy, wanted to reboost the economy, that places open, you know, bars and stores and that sort of thing opened. And so here's an opportunity. I have a means of making money to survive. And so are you going to stay home? 9 times out of 10, not. You're going to go to work, and then you're exposed because one, they're not practicing social distancing. So just take the example of working in a bar or a restaurant. As a waiter, you're around people that are eating. So how are you, even though you have a mask on, you still have stuff, particles up in the air.
Very good point.
You know, before they were saying that it's respiratory, it's not necessarily airborne, it's contact. I don't know what it is.
Right.
What I do know is that a lot of people are being exposed.
Right.
And so, once again, that's that discrimination. And so, it's that systemic discrimination because some don't have a choice. If you want to survive, if you want your family to survive, you have to go out and you have to put yourself in harm's way, so to speak.
Yes, you're absolutely right. And so oftentimes it seems that more so African Americans are the ones who are in harm's way, or people of color, because of the jobs that we have. And some of that is due to limitations with education. And so when we look at education and the wealth gaps in this country and even in our respective states, inequities in access to high quality education for some racial and ethnic majority or minority groups can lead to lower high school completion rates and barriers to college entrances. And this thus limits the jobs that we can get. And people with limited job opportunities or options likely have less flexibility to leave jobs that may put them at a higher risk of exposure to the virus that causes COVID-19. And so we talked about that. Oftentimes, it depends upon your level of education that can allow you to get certain jobs that could be a contributing factor to the reason that you are on a job that puts you at a higher risk to be exposed to the virus that causes COVID-19. And, you know, that's a challenging place to be in. I also want to add that certain industries that have workers that are predominantly minorities know that they face, it's been studied and it's been researched to understand that these minorities face higher rates of COVID-19. Meatpacking plants, where the rate of COVID-19 infections are higher than the rate in 75% of US counties nearly half the workers in some of those meat packing plants are Hispanic, and a quarter are African Americans. And so, right there, you can tell that a lot of those jobs are disproportionately filled with minority workers. And then those people are being exposed to COVID. But then you look at also the people who are being exposed to COVID and may contract COVID go back to urban areas where there are lots of people. And, you know, Hispanics, Latinx are traditionally known for having larger family households. So you have a lot of people in the household. And so then you put more people at risk. And so let's talk about that. The education that leads to persons being at higher risk for getting COVID because of the jobs that they've had to take because of their education level.
Well, remember, I mean, I don't know how, what the population demographics is, but one of the first places we had the big outbreak was at a meatpacking plant in, I think it was South Dakota, right? A lot of that had to do with the ignorance of the governor, you know, freedom to wear, you know, I don't have to wear a mask, all that. But the people there, I think they were threatened to be fired if they didn't come to work, right? So you know, that stands out in my mind a lot. You know, in that community, there probably aren't a lot of well-paying jobs, and to be threatened to be fired if you didn't come to work. Now you're just now it snowballed, and we saw that it snowballed. So I think, you know, we probably need to come up with something better, like Deacon Ronnie said. How about passing another stimulus package?
Well,
Right.
let me add this. The data from the Bureau of Labor Statistics says that a greater number of African American workers are unable to work from home compared to white workers.
Mhm.
A study of the Mission District community in California showed that Latinos accounted for more than 95% of positive COVID-19 cases. 90% of individuals with positive tests were unable to work from home. So we see that, you know, a large percent of those persons, like you said, even with the meatpacking plant, you know, are unable or not allowed to work from home. There's no way they can work from home. Deacon
Right.
Ronnie?
Yeah, Bishop. And you know, the majority of them don't have health care either.
Right.
So they don't they know they're sick. They don't have a choice. They have to go to work. Whether Deacon Kim said if they don't go to work, if they don't go to work, they get fired. If they don't go to work, they don't get paid. You know, it's almost like a vicious cycle. So you already said in the beginning that the education, if they don't have the proper education, you know,
Right.
they land inside of these type of positions
Yes.
where they are in dire needs, where they don't have education. They have no other choice but to go to work in deplorable conditions. No matter what it is, they have to go to work because they have families to feed. So I think it's even outside of it's in a whole different arena where we as a race have to continue to push the importance of education to our children and to our grandchildren so that we aren't counted in that number of um, non-essential. You still got to go to work. I mean, you know, you still need to make that drink. You still need to run that plate out to that table. You still got to pick up this trash. You still have to do those things. But, you know, just so important that we teach our kids the importance of education so that we can have the luxury of working from home, you know, and so that we can have um, health care. And you know, even if you don't have education, you still should be able to have health care,
Right.
but still don't have those because what we need to do is we have to put food in our kids' mouths, whether than making sure they can go to their doctor's appointment. Our kids got to eat. So if they get sick, you know, do a little home remedy or whatever the case may be, and just kind of try to shake it off because, you know, we don't have, it starts from the top
Right.
and it's just a vicious cycle.
Right.
And you know, I know this probably be another topic too, but at some point it's like you're raised, you have generations and generations and generations stuck in this mindset that, you know, I'm not gonna go to school, I'm gonna do this, I'm gonna do this, and I'm gonna do this. But we got to get out of that mindset, get out of being stuck in that generation. I'm gonna be the one that I'm gonna go to school. Out of
Right.
all
Right.
50 of my relatives, I'm gonna be the one. Then let's, you know, that's 5 more other topics down
Right.
the line,
Right, right.
Right.
But Deacon Ronnie, you're absolutely right, because what happens is that, as you said, and I've said as well, it's a trickle down effect. And so if you're stuck in that particular non-essential job and you're forced to come to work because you need to support your family, even if you thought, and so I'm looking back on Facebook at some of the comments that some of our viewers made, that they believe that some of the reasons why folks are not being tested, we're talking about people that are tested because the numbers that we report of exposure are people that's been tested, but there are a great number of people that are not being tested because, one, they know that if they're tested, they have to be out for at least 14 days or until they get their results. And so that's loss of wage as well. And so once again, you're up against a wall, and what do? And so that was a good point
You
that
expose
one of our
people to the virus.
yeah,
And you put other people at risk. And that's a good lead into where I want my next topic, because, you know, and I think that's a great point, because people are concerned about being able to pay their bills. And so when you talk about, I've got to be off work for 14 days, I would rather just cover up the fact and not tell anybody that I'm having COVID symptoms instead of getting the COVID test. And then I have to be off work. So yes, people are faced with that decision. And that's a terrible decision to have to be faced with, because then you put other people at risk. So when we look at racial minorities, we know that we experience higher rates. Okay, wonderful. We got Minister Eliana. We experience higher rates of chronic medical conditions, including obesity, diabetes, kidney disease, which are risk factors for severe illness from COVID-19. So, on the backdrop of this, we know African Americans have higher rates of maternal mortality, death from cancer, and heart disease than any other racial ethnic group. Individuals from underserved communities are also more likely to have undiagnosed chronic disease, compounding the acute impact of COVID-19. And so, in essence, these are tied to the barriers, once again, that we talked about, that our community may have, which is accessing essential resources such as food. We know we sometimes have that shortage in our community of healthy foods to have access to, transportation, housing, as well as a history of unequal treatment, discriminatory policies, and systemic racism. So when we look at it, it's not just the fact that we're being discriminated against, but we also bring other issues physically to the table. So let's talk about that, because there's so many people also that we know who have had COVID or transitioned from COVID because they did have some other underlying issues.
Yeah, Bishop, I think you bring a lot of points. I think systematically, we are the marginalized. We are, when I say we, because we're all part of that group, we are systematically categorized in a group that's dispendable. You know what I mean? They can use us or lose us. That's why we have more food deserts. That's why we have more medical deserts. That's why our cancer rate is much higher than any other population. We are not, I don't want to say we're not deemed as research worthy, because we're deemed as treatment worthy. They will use our cells to figure out how to treat diseases, but as far as treating us is a whole different ball game. But it's a systematic problem that we have going on, so much so that in most healthcare settings, they have diversity groups now. They have to have diversity groups because they're showing the disparity in healthcare treatment. But we have to remember that if we are working in these jobs and we don't have benefits, we don't have the right benefits. I don't have time to take off work to figure out why I have a headache every day. I don't have time to take off work to figure out why my body's swelling. I can't take off work to do these things because I have to put a roof over the head of my children. And then on top of that, I need my kids to go to school because I can only afford to pay for one meal a day. So now I don't have time to take off work. I'm sending my children to school because they need a meal. So even if they're sick, I'm sending them to school because they need a meal. And this is the system that we live in. And it's so unfortunate that we are living in this system. We do have a voice to say something on our behalf. We're always going to be here, unfortunately. I mean, even you got to, really think about it. When people started moving out to Maryland, okay, let's say when they pushed us out to Maryland, how about there weren't any grocery stores out here? How about we didn't have grocery stores? So we're the wealthy minorities moving to Maryland, and you still put us in a food desert because you can. Like it's just, that's just the nature of what's happening. But I think it's really important that we speak out. We have to say something every chance we get. We just have to say something.
Yes, and I'm so glad you brought up the food desert piece because that is known in our communities of color that did not have access to fruits and vegetables. And so therefore, I don't want to refer to us as damaged, but we did have a certain degree of challenges because we were not eating those things that could help us to develop healthy systems. And so we were more prone to asthma and those types of things. And because of the communities and where we lived, we were more prone to have problems like high blood pressure and, some of those types of things. And so we are just getting access on a regular basis to healthy foods and having healthy eating and starting to develop healthy eating habits. And so I believe that those are contributing factors also to why we struggle so hard with the COVID-19 and making a comeback once persons have contracted the COVID-19. Did anybody else want to comment it? Go ahead.
Oh, I just want to say one thing on that. The fact of us eating healthy, the ironic thing is we always did. It's not available to us. So that's why we went to the fast foods and this, that, and the other. Because I know we can all think about when we were younger, McDonald's was a privilege. It was not a normal meal. That was a privilege. What was a normal meal was you were going to have something green on that plate.
Some greens.
Eat on that plate. You're going to have some greens. You might have something else. You had a meal every night, no matter you liked it or not. You had a whole meal. And then most often in the morning, you were grabbing some type of sandwich. Now, granted, it probably had bacon and sausage and eggs, but you were grabbing some sandwich to go out the door. Like, we ate healthy. That was taken from, if you don't give us and then we don't have butchers in our area. When you have to go to a butcher, where do you go? You go to one of their neighborhoods. When you want to go to a farmer's market, where you going to go? One of their neighborhoods. We didn't have those problems. We had all of that in our own neighborhood. But you've done so much that we don't even have it anymore. So you're right. Now we're learning to eat healthy again. Not because of us, but because it was denied.
Yes. Right. And so you have a whole generation that grew up on the McDonald's, the Burger King, the Taco Bells, all those types of things. And now they're being forced to not eat that anymore because the only time they knew about that was if they went to their grandma or great grandmama's house. And that's when they ate that. Grandma said, no, you got to have some greens, baby. We got to give you some greens and we're going to give you some cornbread, and, something that's going to help you.
Lots of milk.
Yes. And so, all of that has contributed to, I think, the racial disparity that we're seeing for minorities with this COVID-19. And a lot of people are not thinking about the fact that, and I've had this conversation with a few folks. If you have tested positive for COVID-19, you now have a pre-existing condition. And so when you talk about those who want to get rid of Obamacare, those who want to release and no longer see certain parts of the Affordable Care Act, I should call it that, and they were trying to possibly figure out the pre-existing condition piece. All of those who have had COVID-19 you now are going to be considered in that block of people who have a pre-existing condition. And so, what do we now do with that? That's something else that, once again, the majority of people who will have that pre-existing condition are people of color. We've heard the numbers, we've heard the statistics, heard about the research. And so, once again, if they get rid of that, that is going to impact our communities extremely hard once again. And so we'll be restricted from healthcare unless we are able to pay high prices to be able to get the care that we need. And so while we shouting for certain folks to get rid of stuff, we need to think about who is going to be impacted if they remove the Affordable Care Act.
And Bishop, the other thing to that is that you talk about the number of people of color that's exposed, which is the highest number. But if you think about re-exposure, and so
yes,
a lot of people don't even think about that. You're exposed, you can become re-exposed after getting well. And so once again, it's that precaution. You got to protect yourself. You have to wear your mask. You have to practice social distancing. And you have to high touched items. You have to make sure that you just protect yourself. You just have to. You have to do good hand hygiene. And so it's mind-boggling that. Do you think that? I think some people might think, well, what is the point? Where's the hope in it? And I know that there is hope. I can't tell you where it is and when it's going to happen, but there is hope. Yeah. But every single body's responsibility, and I can't stress that enough, it's everybody's responsibility to protect yourself and protect the loved ones, even the people that you don't even love that's around you. You have to protect them. Mm-hmm. And that's real.
Yeah, that is.
Yeah.
That is.
Yeah.
And when you think, like Bishop, like you said, the Affordable Care Act, the thing about it is a lot of us, the minorities, the marginalized, don't really understand what that means. And what it means is those of you who are, highfalutin, you got your health insurance, you're not worried about anybody else, your premiums are going up. Your premiums are going up because me, who may not have health insurance, who has a pre-existing, I'm not going through the front door for a $150 visit. I'm going through the side door to the emergency room for a $5,000 visit. Then I'm going to stay in the hospital for I don't know how long. Mm-hmm. And then when I do get out of the hospital, I won't have follow-up care because I can't pay for it. So then I'm going to come back through the emergency room. So next year, when you choose your benefit package and you wonder why it went up $20, it's because you wouldn't allow me to be insured. Like this is a whole cycle. And you got to really understand what that means. And the sad part about it is we are the country that is supposed to provide health care in a gratuitous way to specialized care from other countries so they can bring their patients here to us. Well, if we're using all of our finances for our own people who can't be insured because they had COVID or what have you, then when I have this child with this unique condition that if we can figure out how to help this child, we can help 1,500 more back in their country, we can't do it because we don't have the money to do it. And then you really think about it, you stop paying money, and I'm being truthful, you stop paying enough money to hospitals, they don't have enough money to hire the best.
Right. So
get ready for that institutionalized healthcare where you really are just a number. And that's dangerous. It's really dangerous. And, I hate to say it, but the group that's sitting there talking about getting rid of the Affordable Care Act, they don't have an answer because they pay fee for service. When they walk into the doctor's office, they pay for it. So they don't have an issue, but they'll have it if anybody in their family has a terminal disease, because I don't care how much money you have, $1 million a year to deal with certain terminal diseases you can't afford. But they don't, right now, it's always us. Whenever they think it's just us, they won't do anything about it.
Yeah.
And that's what we have to say. It is us, and you are going to do something about this. Or you know what? None of us are going to go into the pediatrics office. We're going to come to the emergency room for immunizations this year. And you won't get paid for not, because Sylvester will tell you, you won't get paid for not one of those visits. I'm going to come through the emergency room if my earlobe hurts. And you won't get paid for no visit at all. You know what I mean? And maybe the hospital costs also need to get on our side. I know some hospitals are going to the Hill like, we can't do this.
Right.
But we need people to be on our side. And then half the visits that come through the emergency room, we're not going to get paid for. And, you know, I'm talking from a hospital perspective. And if we don't get paid, it's a ramification for that, you know?
Yeah.
It's just so unfortunate. But Deacon Sylvester, I agree with you 100%. Protect you, protect the people you don't like, protect the people you do like, protect the
Yeah.
people you don't know. Just protect everybody.
Absolutely.
Yeah. And
I
so
wonder,
lastly,
I wonder if they, no,
go
I was
ahead.
just gonna say, I wonder if they had compiled any statistics on people who were covered to the age of 26 on their parents' plan who contracted COVID. That's just something, because, you know, that's one of the things about the Affordable Care Act that I really liked, was when they took away those lifetime, the what you call it, the limits on your lifetime care, and then they let your kids stay on your plan up until 26. But I was just wondering how many young people out there who were on their parents' plan contracted COVID. Like, what could have happened if they weren't covered? You know, I don't know.
That's so they actually do studies on how many children come in for care after the age of 21, but are still covered by their parents. But I bet you somebody, Kim, you need to say that real loud, because I bet you somebody's going to figure that one out. Because I mean, think about it. That price tag is serious. An ICU, one day in the ICU.
Yeah,
that thing is.
Yeah.
It's serious.
I think, you know, that to me was like, oh, it was such a godsend, that because it's like people expect that when kids turn 18, they're going to get a job that's going to have benefits and everything else. That's why so many young people don't go to the doctor, because they don't have jobs that provide benefits like that. And the Affordable Care Act came along. I thought it was great, because you can stay up to 26 years old. By that time, you kind of, you know, you find something where you can get benefits. But, you know, another thing about the Affordable Care Act that I like, because I remember having this conversation on the phone with my healthcare plan once. They told me, well, we're going to make an exception this time, but this can't ever happen again. I'm like, and then that time I was in my 40s, and I was like, wait. I mean, I took this lady through it. I was like, so you're telling me that right now you're going to provide me with this exception, and then if it ever happens again, you will not cover it throughout my whole life? I was like, nah, forget it. And I hung the phone up. I thought that was absurd. You're going to tell, you know what I'm saying? I mean, I don't know what's going to happen for the rest of my life, but you're telling me right now at like 43 that this can never happen again? And so that the Affordable Care Act took that away.
Yep, it did that.
Wow.
And Kim, you know, it also helped your kid. If you have your kids on life insurance policies, you can keep them on that child life insurance policy until they are 29 years old. Then they can take that policy and turn it into whole life care. How many of us were thinking of life insurance at 21? We were not. We probably weren't thinking about it at 29 either, but maybe we got closer to it. You know what I mean? It's so many things, so many more than just that piece that people just don't know what the Affordable Care Act does. There's so much more to it.
So that's a great lesson. And so people may want to go and find out some other positives to Affordable Care Act versus what you're hearing people say are the negatives. Lastly, we do want testing, again, to continue to be made free. We need it to be widespread. That was one of the things we talked about, how, you know, it's in certain areas and it seems like it's more accessible to non-persons of color. Also, we want the testing to target communities that are most impacted by the COVID-19, namely communities of color. But we know the Family's First Coronavirus Response Act passed in March 2020, eliminated cost sharing for COVID-19 testing related services for those with private insurance, and granted states the option to cover costs for uninsured patients. Y'all reminded me of the TikTok thing here.
This totally took you off guard.
Yeah, the TikTok thing. But also now we want to make sure that still there have been reports of that we understand still the reports of persons of patients facing hundreds of dollars in medical costs due to testing. Shortages of COVID-19 tests force providers to administer multiple non-COVID-19 tests to rule out different diseases that the person may have. And in essence, when they do that, that raises the cost of that person's medical bills. And so we have got to make sure that the COVID-19 tests are available in all areas to all people, but also doctors and trying to rule out other things are not running up unnecessary medical bills for person of colors who already cannot afford, in many instances, the health insurance, and also cannot afford to pay the over expense that is not covered by the insurance companies. Let's talk about that, and then we can have final comments, and then we'll be off for tonight.
I think for the most part, there are regulations or limitations, if you will, with billing. And so most cases now, it's part of the mission, certain lab work. And so regardless of how many tests, how many x-rays and that sort of thing, the insurance only going to pay for maybe one or two of them, depending on your disease, depending on your care plan. And so I don't know that that's specific now today. Maybe a couple of years ago, 10 years ago, 20 years ago was a huge issue. Overbilling, unauthorized billing. I think there's more of a control.
So this from Deacon, this from July 20th, 2020. So that's what this particular article has said. So it may just apply to the COVID, but go ahead.
May happen, and we have to be really careful about our conversation, not generalizing it for all places and all locations. But in general, yeah, I know specifically, not necessarily, but can it happen? Absolutely.
Yeah, it just seems really unfair. Once again, as I stated, I have a family member that has that and is unable to access a site for COVID-19. So now, if they start developing other symptoms and have to go through the emergency room, then, you know, is there going to be a cost? Because an ambulance, because you can't get in the Uber, can't get in the Lyft, an ambulance is going to have to take them. And so now, you know, what are going to be those costs for that? Again, I want to remind people, in the state of Illinois, Latinos have nearly 7 times the rate of COVID-19 cases compared to whites in Illinois. African Americans have the highest death rate from COVID-19 in the state of Illinois. When you look at California, Pacific Islanders face a death rate from COVID-19 that is 2.6 times higher than the rest of the state. In South Dakota, the rate of COVID-19 among Asian Americans is 6 times what would be predicted based on their share of the population or their makeup or demographic. And so this is a real issue that people of color, when you talk about COVID-19, are at a seriously disproportionate number when you talk about developing or getting the virus and dying from the virus in all areas across the country. Because South Dakota, that ain't really an urban area. So, you know, I mean, no matter where people of color are, it seems that we're at a higher risk of developing COVID-19. So any final comments from anybody on the panel?
I have one in terms of clarification. We talked earlier about language barriers and communication at COVID testing sites. And so looking at Vera on Facebook, they do have interpreters of certain types, Chinese, deaf, but they have interpreters to help meet the needs of the clients, if you will. And so that's a good thing. So hopefully that's generic across the board, but don't know.
I don't know if they got those at CVS and the Walgreens. But okay, we're glad to know they have
Yeah.
interpreters.
Well, one of the things we say at work in terms of interpreting, we do have an interpretation service, language interpreter
Yes, yes,
department. And so we're definitely encouraged not to interpret, even if we know the language, because
yes,
we're not certified.
yeah,
And
yeah.
so you got
Great
to put
point.
it right. How many certified people are at the site?
Right, exactly. Because they'll start asking you other questions that you really may not know how to answer. Anybody else? Well, once again, we do realize that the numbers are coming up all across the country. We heard Deacon Sylvester share that with us. So we do encourage everyone to wear a mask. If you need, wear two. If you need, get a face shield. Also, if you need to, wear gloves. Make sure you're using hand sanitizers. Make sure you're washing your hands. Make sure, I want to even add, the bishop is adding, spray your clothes. Okay, because we go into all these different spaces and things get into the fiber of our clothing. So spray your clothes also. You could spray your shoes because you walk on these different surfaces. We don't know what's on the surface. So spray your shoes as well. And then remember, for the holiday that's coming up, we are now limited in many states how many people we can have in a gathering. So I understand it's Thanksgiving. I understand some people enjoy celebrating that holiday, but I would say we want to choose life. And if you have to postpone the holiday for 1 year and just talk about all the wonderful things you're going to do for the following year, maybe some of us need to consider that because we want to be here when this is over. And so if you want to be here when this is over, if you're choosing life, if you're choosing to finish the purpose and plan that God has for you, then you'll be able to follow many of the guidelines or all the guidelines that they're giving us to help us stay safe. And so one of those is to limit the gathering numbers, the people that you expose yourself to, and to also make sure that you're not going to spaces and places that may put you at higher risk. And if you have to be on a job, then make sure you're using every precaution you can to stay safe. All right, so thank you again to Deacon Sylvester Stokes for being on tonight.
Amen.
Thank you to Deacon Kim Hall for being on tonight. Thank you to Deacon Ronnie Bullock for being on tonight. And also Minister Eliana, who sat in for her for a few moments. Thank you so much for being on tonight. And once again, join us on Sunday at 11 a.m. for a powerful worship. And those of you who have been donating towards our winter giveaway, thank you so much. We have raised I don't know how much. They've sent me different messages, so I don't know what number we're at now. But we thank you in advance. We will make sure that we show you all of the wonderful hats, gloves, scarves, socks, toothpaste, toothbrushes, everything that's going to be in those packages that you're helping us. And so all of you will know Bishop has asked everybody to be a part of the overflow. And so what I meant by saying that is we had a goal of 100, but the overflow is everything over 100. So help us go into overflow, being able to
Amen.
bless more people than we thought we would be able to bless
That's good.
during this season. So I need all of y'all to be a part of the
Come
overflow.
on, Bishop.
Thank you
Amen.